future nurses. A blessed day to all of you. May God continue to bless your journey towards nursing profession. May you be guided by His Holy Spirit and be able to overcome all the challenges that comes your way. Just keep a positive attitude and believe in yourself that you can do everything with the guidance of our Almighty Father. Before proceeding to our discussion, let me share to you this disclaimer slide. Please note, no copyright infringement is intended, and I do not own or claim any images, designs, and any of the original information stated and used in this video. And this is used for educational purposes only. If any content owners would like to dispute this, I will not hesitate to immediately remove the said content. If you happen to find your art or images in the video, please let me know and I will be glad to credit you. Here is my email, aubrey.tairit@cjhc.edu.ph. This presentation is a continuation of our topic in the previous sessions or in the previous videos that we discussed about nutrition management of patients with particular disease or conditions. In the previous video, we talked about the nutritional management for diabetes mellitus, cardiovascular disease, pulmonary disease, renal disease, GI disease, and musculoskeletal disease. So in this presentation, our focus is the diet therapy or nutritional management for patients with neoplastic disorder, surgery patients, and those patients diagnosed with AIDS, and patients with fever and infections. So, neoplastic disorder or cancer is not a new term to us. We've heard this term or this kind of disease from our friends, relatives, or even we saw it in the social media. So cancer is a group of many dissimilar diseases categorized by unfettered replication of cells. So it is characterized by uncontrolled growth and spread of abnormal cells, forming a mass called tumor. There are two types of tumor. There is malignant tumor and benign tumor. Of course, cancer is a formation of malignant tumor that takes away food and blood needed by the normal cells, and it interrupts their roles to maintain life processes. The etiology factors implicated or known to induce carcinogenesis include viruses and bacteria, physical agents, chemicals, genetic or familial factors, lifestyle factors, and hormonal agents. However, additional research is needed for a better understanding of the relationship between etiologic factors and cancer. So, to understand cancer, let us have a short review of pathophysiology of cancer. So the pathophysiology of cancer involves three processes or stages in carcinogenesis. So the carcinogenesis is the formation of tumor from initiation, promotion, and progression. During initiation, this takes place when a carcinogen-like virus becomes activated in the body and binds to the DNA. During this stage, damage or mutation to DNA causes excessive cell division because our body have excessive oncogene function but decreased suppressor gene function. And during promotion stage, or this is also known as stage where the growth of cancer cells happen. So the mutated cells are exposed to promoters that enhance their growth. Example is estrogen that promote the growth of certain type of cancers, or even those carcinogenesis that you get from smoking. And then the third stage is the progression. This refers to the uncontrolled growth of cancer cells and malignant tumor develops. During this stage, the tumor cells acquire additional mutation and their growth rate increases. This allows them to metastasize or spread throughout the body and makes them resistant to therapy. There are two kinds of tumor. We have benign and malignant tumor. So benign tumor refers to a tumor that is confined to an area where it originated. So it does not spread and it is not cancer. The growth is just slow. Once this tumor is removed, it does not come back. So another kind of tumor is the malignant tumor. This may multiply slow or rapidly and can invade and injure tissues and organs. It can also enter the bloodstream. So moving on to the different types of cancer, we have carcinoma, sarcoma, glioma, and lymphoma. Carcinoma is a type of cancer that arises from the cells of skin, glandular organ, and inner linings of internal organs. Sarcoma is a cancer that develops in the muscle, cartilages, connective tissues, and bones. On the other hand, glioma originates in the central nervous system and supporting connective tissues in the brain, while lymphoma is a cancerous growth in the lymph nodes and other tissues of the lymphatic system. These are the symptoms of cancer that you have to watch for. So remember this abbreviation, caution us. C stands for change in bowel or bladder habits. So changes in bowel, for example, how many times a day the person has bowel movement or how many times a week. If there is changes, kung before, every day, this time, once a week or 2 weeks, so kailangan na natin ng i-check yan. Or bladder habits, okay? Is there frequent urination? So, yung chine-check naman natin for the changes in bowel, we are checking, for example, for colon cancer. For bladder habits naman, we are checking, for example, prostate cancer. And A stands for a sore that does not heal, probably related to skin cancer. U, unusual bleeding or discharges. This could be there could be a problem in reproductive system like ovary and uterus. Thickening or lump in breast or elsewhere. Okay, lump in breast could be a sign of breast cancer. So indigestion or difficulty in swallowing there could be problem in the oral or cancer of the mouth, throat, or stomach. Okay, obvious change in wart or mole, a nagging cough or hoarseness could be a sign of throat cancer or thyroid cancer. Unexplained anemia could be related to hematologic cancer. And sudden unexplained weight loss, which is a general symptoms of problem with cancer. These are the recommended tests. This is just a summary. So pap smear and pelvic examinations for female 18 years old and above. For a specific recommended test, I also have another video about cancer. So doon, nandun yung mga specific recommended test per age bracket. For self-breast examination, this is recommended at the age of 20. And mammogram between ages of 40 to 49. Digital rectal examination after age of 50. So for male, you can have prostate-specific antigen to detect prostate cancer starting at the age of 50. Fecal occult blood test, this is to check for colon cancer after the age of 50. Sigmoidoscopy after the age of 50 also. And of course, dental checkup to check if there is any problem in the oral cavity. Cancer patient could experience the following nutritional problems. They may have anorexia, constipation or diarrhea, dumping syndrome, chewing and swallowing difficulty, fatigue, mouth soreness, mouth dryness, nausea and vomiting, low blood counts, and there will be taste alterations and weight loss. So to manage the nutritional needs of the cancer patient, the focus or the goal is to improve or maintain the patient's optimal nutritional status, to maintain the patient's strength during therapy, and to prevent or reverse immunosuppression. And of course, to provide long or short-term measures to ensure survival. So the nutritional management for patient with cancer. For oral feeding, you can prepare a high-calorie diet. You can also give high-protein beverages. For meal replacement, it should be 1 kilocalories per ml, and the strategies are the following. For patient who has anorexia, you can give at least 5 or 6 small meals. For patient with constipation, you can give a high-fiber diet. And for patient who has diarrhea, you can limit the milk products and avoid gas-forming foods and increase potassium-rich foods. For patient with dumping syndrome, you can give small frequent feedings, and you can restrict carbohydrates and increase protein and fat. For patient with early satiety, you can give small, frequent, high caloric density feedings, limit liquid meals, and avoid gas-forming foods and high-fat or greasy foods. For patient with chewing and swallowing difficulty, you can modify the foods to a soft consistency and avoid rough textured foods. For patient with fatigue, you can give a small and frequent feeding, energy-dense and high-protein diet. For patients with mouth soreness or throat irritation, you can advise them to avoid tart, acidic, or salty beverages and foods, spicy, and eat soft, bland foods. For patients with mouth dryness or thick saliva, you can limit the caffeinated drinks and foods. For patients suffering with nausea and vomiting, you can give small frequent feedings and eat dry, bland foods. For patients with neutropenia, make sure to cook the foods thoroughly because neutropenia means or can occur when the patient or when a person have too few neutrophils. Neutrophils is a type of white blood cells. We know that white blood cells help our body to fight infections. Therefore, kung sobrang baba yung kanyang neutrophils, there is a high risk for the patient to get infection. Okay, for a patient with taste alterations, you can provide cold or room temperature foods. For a patient with weight loss and muscle wasting, you can give a small, frequent feeding, high-calorie and protein-dense foods. For patient under tube feeding, a finely dispersed formula or blenderized pureed and liquid foods may be administered using nasogastric, esophagostomy, gastrostomy, or jejunostomy tube. There are 4 types of tube feeding. One is complete products. So, the complete tube feeding formula is made with real food ingredients including chicken, fruit, vegetables, and cranberry juice. This type of formula is designed for patients who desire for real food component to their actual feeding. Another one is chemically defined products. This refers to a minimal or no digestion formula. This is usually given for patients with pancreatic cancer. Another one is modular products. This is usually used in combination with other tube feeding products to enhance calorie or protein intake. Another one is specialty products. This type of formula vary in terms of specific amino acid, carbohydrates, and fat content. This is for patients with hepatic or renal failure. So aside from oral feeding, tube feedings, as a nutritional management for patients with cancer, we also have total parenteral nutrition. So TPN or IV hyperelimination may be used when the digestive tract is not functional or cannot handle the volume needed to meet the patient's nutritional demands. So this type of method is used to administer calories, proteins, vitamins, and other nutrients into the bloodstream of the patient who is unable to eat. Now moving on to another topic, let's talk about nutritional management for patients undergoing surgery. So surgery is defined as a planned anatomical alteration of the human organisms designed to arrest, alleviate, or eradicate some pathologic process. So we have here a preoperative diet, which means this is the diet given for a patient before the surgery. So the patient should have high calories with at least 50% or more than the REMI requirement. High protein, at least 50% or more, vitamin and mineral supplementation, and the patient must have liberal fluid intake, and the patient is also advised to have small frequent feeding for at least 6 times a day. So moving on to the diet for patient under elective surgery. When we say elective surgery or elective procedure, this refers to the surgery that is scheduled in advance because it does not involve a medical emergency. So the patient should have high protein, high calorie, and should have vitamin and mineral supplementation. Okay, so now let's proceed to the post-operative diet or the diet of the patient after the surgery. So during the first few hours after the surgical procedure, the patient is placed on NPO diet or nothing by mouth, and the doctor will wait until the patient can have flatus because this means that the gastrointestinal system is now functioning. So usually, ginagawa ito if the patient undergo a procedure that involves the gastrointestinal systems or it involves a use of a general anesthesia. Now, if there is a flatus na, the doctor may order a clear liquid diet. So, an example of clear liquid diet is water, black coffee, tea, broth. Yan. And then, if the patient can tolerate the clear liquid diet, the doctor will now order a full liquid diet. So an example of full liquid diet includes ice cream, pudding, milk, cream, or a cream soups. Yeah. And then after full liquid diet, if again the patient can tolerate the full liquid diet, now the doctor will order a soft diet. And then finally, if the gastrointestinal system is now functioning well, the patient will be placed on regular diet. Now let's move on to a diet therapy for patients with AIDS and those patients with fever and infections. So HIV or AIDS refers to acquired immune deficiency syndrome that is caused by HIV or human immunodeficiency virus. An infected person can transmit the virus through exchange of body fluids. This can be through sexual intercourse, blood transfusion, sharing of contaminated needles, and mother-to-child during pregnancy, childbirth, or during breastfeeding. So, the goal of the nutrition therapy for patients diagnosed with HIV or AIDS is to preserve the lean body mass, to provide adequate amounts of all nutrients, to minimize gastrointestinal symptoms, to improve quality of life and prolong survival, also to provide supportive and non-judgmental care to establish a trusting relationship with the patient. Okay, this is the clinical manifestations of AIDS. Okay, so for the immunologic, there would be low white blood cell counts or CD4 count of less than 200. And then the opportunistic infections causes some of the signs and symptoms. There would be lymphadenopathy and fatigue. Okay, so the opportunistic infections causes the following infections: the protozoal infections, fungal infections, bacterial infections, and viral infections. For the integumentary system, the patient could have poor wound healing, skin lesions, and night sweats. The causes could be candidiasis that cause the stomatitis, or if esophagitis and vaginal problem. Okay, for the respiratory, there could be cough or shortness of breath. And this is caused by bacterial infections or the Mycobacterium complex that causes that or can cause tuberculosis. Yeah. The patient could have gastrointestinal problems too, like diarrhea, weight loss, nausea, and vomiting. For the central nervous system, the patient may have confusion, dementia, headache, visual changes, personality changes, pain, and seizures. So to prevent transmission of AIDS in the healthcare setting, you nurses or future nurses and all the healthcare workers must maintain the following standard precautions. You have to practice hand washing or hygiene. You have to practice the 5 moments of hand washing, that is before going to the patient, before doing the procedure, after doing the procedure, before going to another patient. Yan. And you have to wear protective barriers such as gloves, mask, eye shield, and gown. Do not wick up needles and syringes. Make sure to clean up spills of blood and body fluids immediately using germinal solution. And consider all body fluids to be contaminated. Avoid contaminating the outside of specimen containers during collection. You have to cleanse work surface areas with appropriate germicide, with at least 1:10 concentration of household bleach is effective. So it is important to give energy, protein, fat, vitamin, and minerals and others as nutrition therapy for patients with HIV. So for the energy, you can use the Harris-Benedict equation and adding allowances for activity, injury, and stress. For symptomatic patients, you can have at least 35 to 45 kilocalories per kilogram. For protein, you can give 2 to 2.5 grams per kilogram of DBW. And for fat, you can increase the use of omega-3 fatty acids and decrease sources of saturated fats. So you can also give vitamins and minerals. Make sure to balance prophylactic levels of vitamins and mineral supplements. Additional levels of other nutrients could also be given. Beta-carotene in doses of 30 milligrams per day. And for others, especially for those who have enteral feeding, you can give moderate fat, high in nitrogen, lactose-free, high in fiber, and glutamine enriched. So now let's move on to patient with fevers. So fever refers to elevated body temperature. So the normal body temperature can range between 36.1 degrees Celsius to 37.2 degrees Celsius. Above it could be considered as fever. So it is caused by a variety of conditions such as dehydrations, allergic reactions, certain types of cancers, and respiratory infections. Okay, so for your diet therapy, make sure to raise the BMR to at least 7%. And you can also increase the protein intake of the patient, that is to replace the body tissue or to produce antibodies to fight infection. You can also give minerals and vitamins to help build and repair body tissue and to maintain acid-base or electrolyte and fluid balance. Also for energy metabolism. You can also give extra fluid, that is to replace what is lost through perspiration and possibly vomiting and diarrhea. So let's move on to another problem, infections. So infections is the result of successful invasion, establishment, and growth of pathogenic microorganisms in a host. This can be classified as acute, chronic, and recurrent. To differentiate the three, acute infections refers to an infection that has short duration, sudden onset, and rapid progression. Examples of this are colds, influenza, and tonsillitis. On the other hand, chronic infection could last for weeks, months, and even years. An example of this is TB or tuberculosis and hepatitis. Another type of infection is recurrent infection. This can occur at periodic intervals. Example is malaria. So, pwede kang magkaroon ng malaria this time and pwede umulat yung infection na yan once nakagat din kayo ng mosquito that carry malaria virus. So the goals of nutrition for patients with infections is to provide adequate nourishment to counteract patients' hypermetabolic state, to prevent or correct dehydration, hypoglycemic complications, and anorexia, and to replace nutrient losses and correct iron deficiency anemia. So this is the diet principles for patients with fevers and infections. For calories, there should be at least 13% for every degree Celsius rise, an additional of 10% for tissue catabolism, additional of 10 to 13% if the patient is restless. The safe caloric increase is 50% or even more of the normal allowances. For protein naman, you can give 2 grams per kilogram of body weight or 100% additional protein. That is for tissue repair. And then, for carbohydrates, you can give liberal supply of easy-to-digest carbohydrates. For fats naman, you can increase intake of fats in emulsified form. And then for water, you can increase the water intake for at least 3 to 4 liters per day. You can also give minerals and vitamins. You have to remember that electrolyte balance has to be restored. Supply of sodium and potassium is very important, as well as iron supplementation. For vitamins, you can give vitamin A, C, and B complex. That ends our discussion about the nutrition or the diet therapy for patients diagnosed with cancers, AIDS, fevers, and infection. Thank you everyone for watching and for listening. God bless!